Living with a long-term illness can be stressful. In addition to the normal stresses of life, illness can bring extra challenges, including the unpleasant effects of treatment and medications, hospital appointments, and trying to fit them in with everyday life. It can also leave us feeling isolated, out of touch with the people and activities that are important to us. No wonder stress levels increase, which can leave us feeling overwhelmed. Most of us are used to dealing with some stress in our lives and can cope, but when stress levels increase, we can start to experience problems, such as feeling irritable, anxious or more emotional than usual, or having difficulty concentrating or sleeping. It's helpful to notice these warning signs and take steps to manage our stress and boost our ability to cope. A seesaw is a useful image to help us think about this. On one side, we have the stresses of life stacking up. And on the other side, we have resources, things that help us cope. Physical things like rest, exercise and nutrition, and social or emotional things, contact with family and friends, activities we enjoy, practical support, and information to help us manage illness. As demands stack up, we often stop doing the things that help us cope. The seesaw tips, and the stress starts to outweigh our resources. Particularly when we are ill, we may feel too busy to see friends and family, or not in the right frame of mind to do the activities that we enjoy. To help rebalance the seesaw, it is good to look at the stresses in your life and find ways of reducing their impact. For example, focus on the stresses you can do something about, what you can do to tackle them, and who can help you. Prioritise what needs doing first and tackle one stress at a time. Let go of problems that don't need to be dealt with right now. Lower your standards and work towards good enough rather than perfection. And learn to say no to things that aren't essential or helpful to you. You can also build your resources and boost your ability to cope by making time to sleep, rest, and engage in activities that help you relax. Pace yourself to manage your energy and help with pain and fatigue. Accept help and stay in contact with your support network. Spend time doing activities you enjoy that give you time away from the stresses of life and illness. If your illness means you can't do certain activities, try to adapt them or think about new activities that are more manageable. Overall, remember what is important to you and focus your energies on these things. Finally, there's information and support available. Talk with your medical team, GP, and people involved in your care if you think that you or your family would benefit from further help to manage the stress of your illness.